These are nurses protesting outside the Atlanta VA Medical Center a few days ago over having to work despite a lack of protective gear to keep themselves from getting infected. VA Medical Center workers around the country have been saying that they're being ordered to ration and recycle PPE like masks, which is putting them at greater risk for getting coronavirus on the job. You can see the sign this one woman is holding. It says, "Say no to one mask per week." Sounds dire, right? One mask per week? Practically no medical system in the U.S. has what it needs in terms of protective equipment. But for weeks, we've been hearing about particularly dire shortages in the country's VA's facilities. And that's particularly worrying because VA facilities are responsible for the care of more than 9 million American veterans, a majority of whom are older and therefore at increased risk when it comes to coronavirus. For most of the time that we've been seeing these reports, the VA's leadership has been insisting that all is well and people are complaining for no reason because the VA and all its workers have everything they need. When the Wall Street Journal, for example, reported on internal documents showing that facilities really had begun rationing PPE, a VA spokesperson said in response, quote, "The premise of your question is false. All employees who need PPE have it." That may be the line from the VA, but I can also prove to you that that is absolutely not the situation on the ground. We recently obtained an email that was sent to employees at the VA Medical Center in Charleston, South Carolina. And it has to do specifically with the face mask policy in effect at that facility. According to the memo, VA workers are separated into two groups. The first is Priority Group 1, those at high risk of exposure. Here's the face mask guidance for those Priority 1 employees. Quote, employees caring for COVID-19 positive patients not undergoing high-risk procedures will receive 5 face masks as a 2-week supply. The patient should be encouraged to put on a face mask when someone enters their room. The employee's face mask is reusable between patients. Those employees, those Priority 1 employees, are encouraged to store their own masks in their paper bags when they're not using them. But again, those are the lucky employees because VA says they're at high risk, so they each get a grand total of 5 face masks that need to last them for 2 weeks. As for Priority Group 2, VA workers who work in outpatient care or as screeners at these facilities or folks who work at community-based outpatient clinics. Well, here's the guidance for them. They'll be issued 1 mask per week in a paper bag. At the end of the week, store the mask in the paper bag. At the beginning of the second week, staff will be given a second mask. Those 2 masks will be a 4-week supply. 1 mask to be worn each week and each mask reused for a second week. Like their colleagues in the Priority 1 high-risk pool, the Priority 2 employees are encouraged to keep their masks in paper bags when they're not using them. So the highest risk medical providers is decided by the VA. They get 5 masks to last them 2 weeks. The second priority group of VA employees, including people working as screeners at these facilities, they get 2 masks that are supposed to last them a month. Use 1 for a week, then use the second one for the next week, then go back to the first one for your 3rd week, then use them. We asked that VA medical facility for comment to see if this policy is still in place. They forwarded us on to the National Press Office for the Department of Veterans Affairs, where that national spokesperson told us in part, quote, VA is currently adhering to CDC's contingency capacity posture for PPE use. VA's PPE practices are keeping veterans and employees safe during challenging times, and the numbers prove it. A spokesperson also says, quote, there is no VA-wide guidance categorizing staff by priority groups. Well, I guess that means we know there's not standard guidance across the board for VA workers when it comes to using face masks. It just depends which part of the enormous VA you work for. I mean, the sheer scale of the VA makes this an enormous problem. The failure to get needed equipment in the hands of every VA caregiver right now. I mean, we're hearing that from VA workers who are picketing and protesting outside their workplaces so people know this is what's going on. But the strategy from the VA, which again is a federal agency, it's part of our government, the strategy from them over and over again has been to just happy talk this problem.